Good afternoon, everyone. We'll get started here in just a moment. As you are making your way in, we're going to leave some time just for some of those running a little bit behind to join us, just to make sure everyone is able to attend. But we'll get started here in just a moment. In the meantime, I'm going to have a poll question added to the chat here. If you have attended a webinar of ours in the past, this question will not be any different than those. But for us, it's just a good gauge just to see how you are doing and really just to see how you are feeling supported in your journey thus far in menopause. So I'm going to launch that. If you could just give us some answers, or if even in the comments, let us know how you're feeling. We'd love to see that. I'm going to go on mute, and I'll come back off mute here in just a moment to get us started. All right. I guess it would be helpful too to just let everyone know what the poll question is. I kind of threw it in there without any context. So our poll question is: do you feel supported currently in your menopause journey? We gave you the response selection of yes, no, or sometimes. I used to always think that the option of sometimes felt like it was a little ambiguous, but sometimes really I feel like is a good response to this, because I think you one day could feel supported and the next you don't feel supported. So we felt like it was really important to throw the sometimes selection in there, and it's turning into one of the most responded answers usually, which is pretty funny. Thank you all again. We'll get started here in just a minute. For those of you who just joined, we are waiting until probably about 4 or 5 after the top of the hour to get started. And then I'll do our little introduction here, let you know who is speaking today, kind of through our topic, and let them take it away. So I made a comment about not being able to enter. I'm not sure what that is about, but I'm trying to see if there's anyone in the lobby. I was about to ask, if anyone is unable to make it, could you please let me know? I don't know how you would do that if you're not in the meeting. Apologize for those. Maybe someone's having some technical issues. Give it just another few seconds here. But for those that are in, it's probably worth saying now, our standard webinar format is we do introductions, and then we have our presenter either discussing and talking through a slide deck or a presentation. Or if you attended last month's webinar for the month of October, you noticed that we had Dr. Rebecca Dunsmore-Sue, who is our Chief Medical Officer here at Genève. She was joined by 2 other doctors, Dr. Savage and Dr. Dooley, and we kind of called it like a fireside chat, if you will. And the 3 of them led us through just a really empowering conversation. With the month of October being World Menopause Month, we felt it was really appropriate just for the 3 of them to just provide insights and knowledge. And I walked away feeling so incredibly just encouraged just about the topic in general, but just I felt like the conversation and the questions that were asked were just so enlightening. And so we are doing a similar format for the month of November. As you'll see, today's topic is around menopause lifestyle support with diabetes, which is admittedly a very niche topic, but it's a very prevalent one, just with the month of November being kind of a diabetes highlighted month in general around just the culture of health. Poll is not allowing me to submit a vote. Anyone else having the same issue? I don't know why it's doing that. So how about this? If you are unable to input the poll, you are welcome to, in the comments, just leave how you're feeling, or just maybe give us some general thoughts and feelings regarding how you're feeling. It might have just been that the poll closed incidentally. I apologize about that. But yeah, just let us know in your comments. Even sometimes I feel like that's more engaging when you give us some context in the comments around how you're feeling, if you're feeling supported or maybe even not feeling supported. Perfect. Okay. Cleared up. Everyone is able to join. Stacy, I will go ahead and get us started. Before I do, I just wanted to kind of do some quick introductions. So my name is Tyler Rouse. I'm the Senior Accountant Partnerships Manager here at Genève. I help facilitate our webinars on a month-to-month basis. If you've attended any of our webinars in the past, you will have recognized my face. I am the consistent voice and individual that shows up on these, and then I'm typically joined by some fantastic individuals, and this month is no different. I have the pleasure and honor of being joined by 3 of our registered dietitians. Stacy Cassian, Jennifer Wagner, and then Pamela Mello, who seems to have been having some camera issues. I think she might have dropped accidentally, but she'll be right back on. But for the moment, Stacy and Jennifer are joining me here. And what we have set up here is going to be just a very simple conversation, but very engaging and really interesting. I will let you know if you could just remain on mute. I do kind of monitor and just ensure that you all are, but if you could stay on mute, stay off camera. You can ask any questions pertinent to the information that we're talking through, or just in general. If a question pops in your head, throw it in the chat. We'll try and address those at the end, the conclusion of our webinar. We do save time for some questions and answers. And, from there, Stacy, I will go ahead and turn it over to you if you're ready. And I'll go off camera and pop back in here at the conclusion.
Thank you so much, Tyler, and thank you everyone for joining. This is an exciting topic for all of us to cover. And I apologize, I have a little bit of a scratchy voice right now. And one of the things with this being a casual conversation, you might see me just taking some sips of my tea that I have with me during this time. But I'll give you a little bit of background on myself, and then I'll go ahead and introduce Pamela and Jennifer. So I am Stacy Kazenchuk, as Tyler mentioned. I'm a registered dietitian and exercise physiologist, and I'm the senior director of our nutrition, lifestyle, and lifestyle care arm of our Geneve care that we provide to peri and postmenopausal women. And I also oversee our team of dietitians that we have that support all of our patients in this care in collaboration with our gynecologist. And today we are going to be talking to you about diabetes and really all things blood sugar related. So pre-diabetes, supporting optimal blood sugar levels, how to do that, continuous glucose monitors, what might be some myths or some hype on blood sugar, what's some more on the evidence-based care approach and science around that. And then really how we work with our patients around these concerns. And so throughout this session today, please feel free to enter your chats, enter any chat or comments into the chat function. Tyler will be keeping an eye on this, and we really want to make sure to address those. As we mentioned, this is going to be more of a casual conversation that Pamela, Jennifer, and I are going to have about really what we see in our patients around this topic. And so we want to make sure that we're engaging you in that time as well. One thing to note is that we cannot provide individual medical care on this call. So if you do have personal questions, we may answer that in a more general sense. But please, if you are interested in getting personalized care, that is what we are here for. And so that is where the Geneve platform, to be able to go and book an appointment with one of our registered dietitians to get that care you need, is certainly something we want you to be able to know you have access to. So with that, the other thing I will provide as we introduce ourselves, I think so we're getting to know each other also on a personal level, we'll give a little fun fact. And so I will share that for myself, a fun fact, and this sometimes comes counter to what many people think about a dietitian, but every morning with my coffee, I do enjoy a small piece of dark chocolate. So yes, I do start my day with a piece of dark chocolate, and I am a dietitian, and I also talk about fruits and vegetables and the importance of those. But there is, I think, some balance in finding what we can enjoy. And for me, that start of the day with a little piece of chocolate with my coffee is a great way to do that. And one of the things we often work with our patients is how do we make sure to maintain that joy around food. And that can be hard when we start to have health concerns that come up where our nutrition and lifestyle intersect with that. So we're going to get into that today in our conversation, but that's a fun fact about me. And I will go ahead and turn it over to Jennifer Wagner to introduce herself and her own fun fact.
Hi, everyone. Thank you for joining us today. My name is Jennifer Wagner. I'm a registered dietitian nutritionist, and I work with Genev. I have been with Genev since May as one of their dietitians on the team. And prior to that, I worked at a Johns Hopkins hospital as a pediatric dietitian, closely working with kiddos and their families, and then also in a weight management clinic. So, a big part of me moving to Genev is passion around women's health and kind of bridging that gap between long-term health, reducing long-term health risks, and then also loving the body that you're in. And so that's kind of where my focus tends to be with my patients. A fun fact about me is, let's see, oh, I know one. I'm learning Spanish, which tends to be really hard when you are an adult and you have never taken a language before. So that's a fun fact about me. I would love to be able to serve more in my community. And I happen to live in a community that has a heavy Spanish speaking population. So that is kind of a long-term goal for me and a fun fact. All right, I think I'll turn it over to Pamela.
All right, and Pamela just mentioned a message. She's not able to turn on her camera for some reason. So we're working with that. Pamela, if you can at least, can you come off mute? Is that working for you?
Yes, can you hear
Okay,
me?
excellent. Yes, I can hear you. So go ahead and share about you, and hopefully your camera will come through in a little bit, but at least we can get your voice.
Sounds great. Well, thank you, Stacy. It's so nice to be here. My name is Pamela Malo. I'm a registered dietitian as well and have been for almost 15 years. I've spent 10 years of my career traveling around the country doing nutrition research and gathering data for the National Health and Nutrition Examination Survey. One of my biggest passions with nutrition is combining it with the science of yoga to help people leverage the benefit of mind body practices as they're on their health and wellness journeys. So I'm super happy to be here. And a fun fact about me is last year at age 44, I started doing community theater. And so that's just been a brand new thing in my life and maybe evidence that it's never too late to try new things.
Thank you. That's a great, the great message there. I think with all things, and that's often some things that we're working with our patients on when they come to us. Sometimes this phase of peri to postmenopause is a transition where trying new things is actually a really helpful part of that, whether that's nutrition related or lifestyle related. You'd be surprised at where that can provide a lot of benefit for people. So let's dive into our topic today of diabetes. And again, as I mentioned in the introduction, all things blood sugar related. I think there's going to be a lot of questions that come up here that we're excited to answer. To start with, though, I think it's important that we level set with just some definitions and some background on what is diabetes and what is related to that. So I'm just going to start by, really just what I explain to patients often, what diabetes is, because there's the textbook answer. There's we'll talk about how it's diagnosed, and I think there's times where we just really need to understand what's happening inside my body and why we might get a diagnosis, or maybe there's a family history of diabetes. We want to understand what's my risk and what's that related to. So, where at the very basic level, diabetes is a condition when blood sugar levels are too high for too long, and it puts an additional stress on the body that it's not able to manage in within a normal range that the body optimally functions at. So we all need to have sugar in our blood for energy purposes, for a lot of very important physiological states to just stay alive. It's when, as with many things in our body, it gets too far out of range, whether that's too high or too low, that there can be some downstream consequences. So the body works really hard to keep that blood sugar level in the body at an optimal range. And there is a range around that. We can talk about what that is. But at the very basic level, when that is out of range, too hot, too long, there can be some other downstream consequences, and that's when someone may be diagnosed with diabetes. I'm going to pause there. That's kind of at the basic level, but I'd love to hear Jennifer or Pamela. What are some things that you may share on just what is diabetes with your patients, helping to explain that, and any additions to what I started with?
Sure, I can go here. I generally mention that, diabetes is related to how your body handles sugar in terms of insulin, right? So either your body isn't making enough insulin or it's not using it properly, which then we would call insulin resistance. And of course, we have type 1 diabetes, type 2 diabetes, gestational diabetes, and then some nuanced forms in the pediatric world that are more genetic based diabetes, which are interesting. But certainly what you said, Stacy, it's just really too much sugar circulating in the blood for too long that causes these adverse effects.
Pamela, any additions on your end to that? Okay, she may be not able to get off mute right now. So I think one of the things I did also want to, Jennifer had mentioned that we typically hear about type 1 or type 2 diabetes. And type 1 is usually one that's diagnosed, it tends to be diagnosed earlier in life. However, we often will see this in kids diagnosed. However, it's not impossible to be diagnosed with type 1 diabetes as an adult. And it can often happen when there are hormonal transitions. So, for example, someone postpartum may be diagnosed with type 1 diabetes. And it's also possibly diagnosed with type 2, but sometimes during those hormonal transitions, there can be other things that come up physiologically, and type 1 diabetes can be a part of that. So it's not out of the realm of possibility that even in peri to post menopause, you might be diagnosed with type 1. It's not as common as being diagnosed with type 2, but not impossible. And that type 1 is when your body isn't able to make insulin. And so that's where you might hear about someone having to be on insulin, or they might be given an insulin pump to be able to substitute or mitigate that function that's no longer there. The difference on the type 2 is that your body's able to make the insulin, but you're no longer responding. And that's why you might hear terms of insulin resistant, where the cells are not responding to that insulin for that insulin to then assist in bringing the blood sugar down. So that the purpose of that insulin, and remember, insulin's a hormone, and we got to think about that in the context of hormones. We aren't always reminded that insulin's a hormone. We hear lots about estrogen and progesterone, testosterone, but insulin is also a hormone that serves a purpose. And hormones are messengers. So insulin's a messenger to say, hey, cell, open up, let in the blood sugar. And if the cell is not responding to that, blood sugar continues to rise, insulin continues to get secreted, and so those insulin levels are rising as well to send a stronger message. Jennifer, anything to add on that distinction that you've seen important between type 1 and type 2?
No, I think that was really well said. I think you mentioning that we see that more in childhood is absolutely correct, but I do agree with you that we have started to see type 1 be diagnosed later on with those hormonal shifts. So I think you were right on there with that for sure.
Interesting, always interesting manifestations when those hormones start to change. So let's talk about how we go about diagnosing these things, and what patients may hear related to that. Jennifer, do you want to give some of your diagnosing diabetes entails, and what might be leading up to that diagnosis that a patient might hear about in terms of medical terminology?
Sure. Okay, so in terms of diagnosing diabetes, generally speaking, it's through blood testing or a glucose tolerance test. So we have a blood test called the A1C, which I'm sure you're all familiar with. And then we have a glucose tolerance test, which is where you drink a sugary beverage and then your blood levels are tested in incremental time frames to see how your body is responding to that and what your blood sugar levels are, right, after you have the drink. And then we have the fasting blood glucose test, which is another form of a blood test to see where your blood levels are there. In terms of symptoms and things of that nature, I think a lot of things can manifest in terms of just overall feeling unwell is what I hear from a lot of my patients, right? If they are just feeling not well, they're feeling sluggish, lethargic. We have seen some interesting symptoms in terms of having to use the bathroom a lot more. That's something that comes up. And then also some things with skin, right? So acanthosis nigricans, which is some dark spotting on the back of your neck, in the creases of your elbows, on your knuckles, is a sign or symptom of insulin resistance and potentially a concern for diabetes. And then some nerve pain too, I've heard from a lot of patients in the feet. So that's kind of where I think that would manifest and begin. And then certainly you would have this testing done. And then based on what the levels or numbers are, your doctor would diagnose you with diabetes or would say, oh, I think you're in the pre-diabetic range, or diabetes and pre-diabetes is not a concern for you at this time. And then navigating, what else could be the concern based on your symptoms. And then in terms of just kind of thinking about the pre-diabetes range, I think, there's a lot of concern about, well, my A1C is, this percent. Yes, there is a range for that. And generally speaking, pre-diabetes would be diagnosed with an A1C percentage of over 5.7. So that's kind of what we're seeing in clinic.
Thanks, Jennifer. That is helpful in terms of just kind of, again, level setting. Here are some numbers that are thrown out there. Often we'll see patients that will come to us saying, my doctor told me I was pre-diabetic. My doctor told me I was diabetic. And there haven't been additional education around that. So we wanted to be able to provide some of that. And that's always a great thing with whoever gives you the result of any type of blood test, and especially those related around blood sugar. Ask that question on what does that mean, and what's the, what does it indicate? What should I do? And I think it's important to get understanding of that. And then that's definitely where working with a dietitian can be helpful, of just, okay, now what's the action plan around either maintaining it if it's in a great level, or addressing any concerns. So with that, I see a question coming in right here. So I'm going to take this just so that it's because it's related to the testing. And this one is, what is the test called for the measured test over time? And Heather, I believe this would be the hemoglobin A1C. A hemoglobin A1C looks at essentially it's an average of the amount of sugar that is on your red blood cells over a 3-month period, because red blood cells in particular have approximate 3-month lifespan. And that is over time. And that's going to be a better, more accurate measurement, which is why it's used in the diagnoses, than say a fasting or non-fasting glucose, which is measuring that blood sugar in that moment in time that you have the blood test done. And then Jennifer also mentioned the oral glucose tolerance test, which is another more in the moment response to blood sugar. Jennifer, anything addition on that?
No, I think that was well said.
Okay. And then additionally, you shared currently your situation with being told that you're insulin resistant. And certainly, yes, in certain scenarios, and I would say with all of this, we will all have different scenarios where our bodies may respond, that could impact our body's response to managing that blood sugar. And so definitely working with someone to address that based off of your own response is a great way to do that. And we will talk here in a little bit about continuous glucose monitors, and sometimes those can be a tool to help with that. All right, so what are our concerns, Jennifer, in terms of why would we want to, when someone has concerns on their blood sugar, and why do we want to prevent diabetes anyway?
Oh, for sure. There's so many long-term health risks associated with continuous high blood glucose. So certainly we can have cardiovascular risks, right? As we age, if our blood glucose is not in the range or managed the way it should be, if we have diabetes. We can have problems with our eyes, problems with our feet, circulation problems. I mean, the list goes on. And certainly there's also a risk of, in terms of long-term concern of metabolic syndrome and things along the line of that, right? And so all of those things can cause negative health implications the longer that they are not managed. Generally speaking, it is, so important to have, if you have diabetes, it's really important to have it managed so that you don't have these adverse effects from being unmanaged, is what I'm trying to say, for the long-term risks. I think you can have disturbed sleep. There's depression that can come with unmanaged blood glucose and high levels of blood glucose. And certainly then we have the effect of, Stacey, as you had mentioned it earlier, hormones working against or with other hormones, right? So insulin is a hormone, and insulin can certainly change the effect of estrogen and progesterone in our bodies during perimenopause, menopause. It can also affect, certainly when we exercise, and we release certain hormones when we exercise. So insulin has a way that it works with those types of hormones as well, which is why sometimes we can see a fluctuation in blood sugar when we exercise. So I think, just first of all, having the understanding, if you're having some of these symptoms, getting the testing done, right, to make sure that you're going in the right direction with management of whatever is going on with your blood sugar, is super important, just to avoid long-term health risks.
Thanks. And I think, these things too, we bring them up just to share, like, these are concerns with diabetes or poor blood sugar management over time. However, the great news is there's plenty of things that could be done to prevent. And even if you have a diagnosis of diabetes, there's a lot of things that can be done on the nutrition lifestyle side of things, which is the focus here today, to help manage those symptoms and decrease subsequent risk down the line for any of the conditions that Jennifer just mentioned. And we do bring this up in this scenario because we do see that peri and postmenopausal women are at greater risk for developing diabetes, more specifically type 2, given that the estrogen plays a wonderful role in helping to manage blood sugar. And when that starts to decrease, the body doesn't have that same support from that hormone. Now, not all is lost. That's where we can basically, I always tell my patients, is just because estrogen is decreasing doesn't mean that there's nothing we can do. We just have to pull harder on the other levers that we have available in the toolbox. And then that becomes looking at, what does that look like for you? So that's one of the reasons that we're talking about it here. Jennifer, do you have other scenarios when you're working with our menopausal patients that you're seeing where the type 2 diabetes risk is coming up and you're addressing that?
Definitely. I have a lot of patients that I'm working with now who have a family history of type 2 diabetes. And often my patients will say, Jennifer, look, my mom wasn't diagnosed with type 2 diabetes until she was 55 or 60 and in that menopausal age. And my dad also had type 2 diabetes, and my blood sugar has been great my entire life. but I'm worried. I'm afraid there's this risk genetically that I have. And also now my hormones are fluctuating. What can you help me do nutritionally, right, to sort of mitigate this or decrease the risk of type 2 diabetes during perimenopause, menopause? So there's always that conversation. And then on the other side of that conversation is, look, Jennifer, I've gained 15 to 20 pounds in the last year. Is that going to increase my risk for type 2 diabetes or metabolic syndrome? Is Am I in a healthy weight for my body at this point in my life, or should I have concerns? And so there's that conversation as well. I think really focusing on you know understanding that there is the risk, but also the understanding, Stacey, as you had mentioned before, that we have so many tools in the toolbox that we can pull out and use to help minimize that risk is very important.
Yeah, that's I think that's the great thing here with this. So let's dive in to what are the things that we work with our patients on, all of the factors that can impact our blood sugar, our body's ability to manage blood sugar. And I like, Jennifer, you keep bringing up, metabolic syndrome, and uncontrolled blood sugar can be a part of that. But I think that loops back nicely to what we're looking here is to support metabolic health or metabolic function. Sometimes you might even hear the term now metabolic flexibility. So we are looking to support our body's metabolism in a way that is supportive of long-term health, wellness, and being able to decrease that risk of chronic disease, and how we do that with these strategies. So nutrition seems to be an obvious place to start.
Mhm.
Not certainly not the only factor, and we're going to go into a lot of other ones, but let's start there. And one thing I think I want to call out is that we're talking about blood sugar. And I think what can sometimes happen in that conversation is we can gain a lot of fear around sugar. And
Mhm.
sometimes that
Mhm.
fear can end up being counterproductive. So I want to just initially just call out here, sugar doesn't, let's try not, we don't want to demonize sugar in that way, because the other piece to remember is it's controlled blood sugar is what we want. We have to have glucose in our blood. We need to have that in our blood to function. But let's talk about here the strategies and how we can optimize that function without having fears around certain foods, especially for sugar, for example. Jennifer, does that sound reasonable for a place for us
Sure.
to start?
Yeah, absolutely. Definitely. So I generally encourage, first and foremost, balance in dietary intake, right? So there is room to eat what you love. And if you like cake and cookies and ice cream on occasion in moderation, that's totally fine. Again, as you mentioned, Stacey, as long as your blood sugar is being managed appropriately if you do have a diabetes diagnosis. So, what I generally encourage is consistent intake of energy throughout the day to keep your blood sugar levels stable. And so, what that means to me when I'm saying that to my patients is look, when you're having breakfast, let's balance that and make sure you're getting a healthy carbohydrate with your breakfast. And when I say healthy carbohydrate, I mean something that's fiber rich, right? So, whole wheat toast, something like that. Or if you're going to have a pastry with breakfast, balance that with a protein and a fat so it doesn't break down and digest as quickly, and then spike your blood sugar, right? So, what the whole point of this is trying to say is balance and consistency throughout the day is the best way to approach. Thinking about lowering your blood sugar or keeping it more managed.
I love the combination that you mentioned there, Jennifer, because I think sometimes we not everyone understands the relationship, that the interaction of food, which is so cool. And as dietitians, we geek out on like, wow, food
For
is so
sure.
complex and we can put these things together. And that's such a great reminder that when you're eating a complete food or complete meal, and you have a protein source, you have a healthy fat source, and ideally a fiber-rich carbohydrate source, the impact on blood sugar is different than if you're just eating sugar alone. And so that interaction effect is powerful and can be beneficial. And I'll often, sometimes often with patients, I'll say, just start thinking about eating a carbohydrate source, ideally with a lot of fiber, so a fruit, a vegetable, a whole grain, a bean, lentils, those types of things, and combine it with a protein and a healthy fat, or just even the protein source. It might be a place to start, carbohydrate and protein. Do you have those every meal and snack? That can do wonders if you're not already doing that, especially sometimes depending on how your blood sugar responds. Sometimes those blood sugar highs when you don't have that combination, then trigger a low, and it just leaves you feeling crappy. And so doing that simple initial step, carbohydrate and protein, can really be a great starting point for some people.
For sure. And I love that you mentioned the low too, Stacy, because I think that's something that we often aren't talking about enough, right? We're really focused on blood sugar stability in terms of minimizing blood sugar spikes or elevated blood sugar, but often we're not having the conversation of, hey, look, there is a risk for you to have hypoglycemia or low blood sugar if you're eating a certain pattern in terms of higher amounts of simple carbohydrates, which then rapidly metabolize and digest, and then spike the blood sugar. And then, as you mentioned, kind of leaves us crashing a little bit. And we get that feeling, which my kids call it hangry, when you start to feel a little hangry and shaky, and you're like, oh my gosh, I don't know, I just feel off, right? And then sometimes you can get a headache and feel almost like you're going to pass out in some situations if it gets too low. So I really appreciate that you brought that up, because I think there's something to be said about not fearing sugar intake, but also thinking about, like you said, pairing it with something else that metabolizes and digests more slowly. So we're not getting that spike, and then that's not leaving us feeling like our blood sugar has rapidly kind of tanked, right?
hmm Yeah, no, that and it's always interesting. Remember, a little bit of a physiology here, right? Our physiology is always trying to help us out, and so sometimes when that blood sugar, when that low is coming from that overcompensation, the body says, "Oh no, sugar's going too high. I want to control this. I have your best interest in mind. I'm going to dump a bunch of insulin on it," and then, oops, overcalculated. Now I'm feeling low. So looking at this is a way our body functions. How can we then tailor our strategies to support that physiology and that physiology that's changing in the menopause transition? It's different than the physiology you had 5, 10 years ago. And so respecting that and working with the body that way. And these nutrition strategies are a great way to do that. And I love thinking about what can I add versus what can I take out. We taking away things in life is never fun usually, in the general scheme of things. So if we can find areas where we can add things in, that's great. Jennifer, what are your favorite ads with patients? Things that you have found that's like, hey, this is a fun ad to help control your blood sugar.
Well, I mean, this is pretty typical of a dietitian, but I always say high fiber. So I know
Good.
everybody out there is like, oh my gosh, she's saying vegetables. And yes, I am saying vegetables, but I love how vegetables keep us feeling fuller for longer, and they really truly help with the balance of digestion of the carbs, right? So if we're not talking about vegetables though, and we're going back to just saying like, hey, what are some interesting items that you can include in your diet that might help keep your blood sugar stable? Always go back to the protein, like you had mentioned, Stacy. And I love adding a nut butter or a seed butter in my breakfast in the morning. I love adding some healthy fat in terms of avocado. I will add that to a breakfast in the morning. Again, just helping with that balance of intake so that the carb source that we're having that ends up turning into the sugar, right, within our body, it's not then spiking our blood sugar too high, but it's balanced because we have the other items there to help with that digestion and metabolic process.
Yeah, and you get other benefits too, right? Bringing those
Yeah,
healthy
for
fats,
sure.
you're going to get other nutrients.
Absolutely.
Um, and I like that you mentioned breakfast. We're gonna go in this direction, and this might be somewhat controversial. Sometimes I find that with patients that breakfast can be something that they haven't included in a while, and we always work with our patients. We meet you where you are and what's going to work best for you, because I always say we want to come up with a plan that's going to support you for the rest of your life. We want you to
For
be able
sure.
to think about, can you do this for the rest of your life? That's going to provide the greatest benefit. Then, hey, can you do this for the next 6 weeks? And so this is going to come into a little bit of, and we haven't gotten the question yet, and I'm so surprised, but let's go into the intermittent fasting,
Okay.
and the breakfast piece there,
Sure.
because I have a lot of patients that are like, I don't feel good eating breakfast. I, heard about intermittent fasting and thought, oh, I could do this. This is great. I don't like eating breakfast. I'm going to do intermittent fasting. Let's see if that helps with any weight loss goals. And oh, my doctor just told me I'm pre-diabetic. I've read online that intermittent fasting can help with blood sugar levels. I'm going to give this a try. So I hear that a lot. Jennifer, do you get that from patients?
All the time. And, with social media and a lot of influence from different areas in the healthcare world, there's a lot of chatter around intermittent fasting, right? And I will say, just from the research that I've done personally, I think there's a time and a place for it. I don't think there's a time and a place for it necessarily in perimenopause, menopause. And I certainly don't think there's a place for it necessarily in blood glucose stabilization, right? And thinking about diabetes. And so, yes, a lot of my patients have gotten into this habit. And let's face it, a lot of us are moms, not everyone, and that's okay, but a lot of us are. And we get into this rut of in the morning, it's like rush, get ready. And that has become a lifelong habit, whether you now have older children in college or adult children. It was just a habit that you kind of established of skipping breakfast, right? And then kind of continuing that habit long term. So your body gets used to not eating. And again, it's a habit, right? And so I generally just kind of talk about the process of your metabolism and waking that up. So here's the thing, if you are not eating breakfast in the morning, your body's not going to kind of shoot those hunger cues out to you and say, "Hey, wake up. It's time to eat. My stomach's going to growl now. I'm feeling hungry." But once you start eating, and I always encourage 1 or 2 bites in the morning just to get started, it is fascinating. You will start to hear your stomach growl in like 2 weeks. And you'll go, "Oh my gosh, it's 10 o'clock and my stomach's growling. I feel hungry." It's because you're waking your metabolism up, you're getting your body going. In the absence of eating in the morning, what I generally see is fatigue starting around, what would you say, Stacey, between 2 and 4 o'clock?
Hmm.
For a lot of our
Yeah,
patients, it's like
that's like the
they
magic
hit a
hour.
wall. They
Mhm.
hit a wall, right? And I know for myself too, if I don't get a plentiful breakfast, I can often feel that way as well. So I think energy plays a big role into this. And if we are not nourishing our body to start in the morning and getting that dose of energy that we need through a fiber-rich carbohydrate, and then also through that protein, right? And more fiber, if you can get vegetables in the morning, even better, right? We're not setting ourselves up for success in terms of energy, and we're gonna essentially poop out halfway through the day and go, "Hey, I'm really tired. I have no energy left to exercise or move my body. I don't feel like doing anything." And so just kind of monitoring that energy level throughout the day, and testing the waters, right? Start having a couple bites of a breakfast in the morning. And kind of let go of some of the idea of intermittent fasting and just test it and see what your body does after 2 weeks of having a few bites in the morning.
Yeah, I like that, and I like that smooth transition, or the gentle approach to that. I think, one, if you haven't been eating breakfast, and especially if it's related to digestion concerns, it can be really scary to eat in the morning, and we want to respect the body and the body's response on that. Two, if it's been a habit for a long time, it's really hard to change habits, and so we want to do that gradually and listen to how your body responds. And that's often what I'll do as well, Jennifer, in terms of how do we find a plan where you're eating a little bit earlier to start your day, and then gradually adjust that based off of how you're feeling. It's not like a complete overhaul to this giant breakfast first thing when you wake up in the morning. It's a smoother transition, a gentle transition to that. And I've seen a lot of benefit with that with patients. The main thing I see is that often they have more energy throughout the day. So then they can feel like they're better focus. They're more likely to do activity, which we'll talk to next because they have that energy. And often then snacking at night decreases. It's this
Absolutely.
counterintuitive. Doesn't always
Mm.
like add up. It's not always 1 + 1, but um, a lot of times patients will say, hey, I know that if I eat, my blood sugar is going to go up. I have a concern around my blood sugar going up. So then they say, if I don't eat, it's going to stay down, which is may or may not be the case if we look at the data around that. So they skip the breakfast, but then towards the end of the day and into the evening, they're ravenous. And that's at a time where most people are slowing their day down anyway. And then you're going to go to bed. And then that's when they're eating more than they may need. And then that cycle starts again in the morning. Sometimes people aren't hungry in the morning because they have snacked all the way into the night. And so it can be that vicious cycle. So you got to gently walk that cycle back to provide a more optimal pattern that's individual based. Again, this is based off of our clinical experience with peri and postmenopausal women, where we've seen the greatest success is really finding that balance, starting the day with fiber and protein at a time that works best for you. That's earlier. And not going too long. I think, a recommendation was try to eat within an hour of waking up. That's not always doable. If it's like 4 hours later, maybe you come back to 3 hours later and start making that a little more progressive in that way.
Absolutely. And then just to kind of add on to that, in terms of like the heavier eating in the evenings too, if that's something that you have established as a habit because you're starting to eat later in the day due to intermittent fasting or whatever dietary protocol that you're utilizing, or just GI symptoms, like you mentioned, I generally will coach my patients, right, that you do not have to restrict yourself past a certain hour in the evening if this is what you have been doing all along, right? If that's your baseline that you're eating till 11 o'clock at night, okay, let's work with that. But what can we change what you're eating to, right? And that's the first step. So if you're having, a higher sugar drink in the evening or a higher sugar treat in the evening, what can we swap that for that might give you fiber and protein instead, so that at least you're getting more nutrients later in the night? And then that will help with regulation of blood sugar throughout the night while you're sleeping as well. So then we're hopefully not going to see a spike when you wake up in the morning from eating too much in the evening the night before. So I think that's a good place to start. And then, as you had mentioned, just inching it back a little bit at a time, right? I always do the 30-minute inch back. Like, hey, if you're eating till 11, let's see if we can cut off at 10:30. Let's do that for 1 week. Then the next week, we're going to go to 10. So it doesn't feel like such an overwhelm and such a pain point, right? Because our job is to help women feel vibrant and happy. We don't want to create more stress for you. So we're trying to do this in an easy, low stress way, but also while we're doing that, we're changing habits for the better to reduce those long-term risks.
Great. Well, let's talk about the movement piece of this. We could see Jennifer and I are very passionate about this topic. We could just keep going on and on about all aspects of it, and we know that you all have this is your time that you're taking out of your day, so we want to be respectful of that. And I do want to cover the movement piece of it because that is also another ad that can be important and certainly can range a whole spectrum of activities. So just putting out there, any movement is going to support your body in managing your blood sugar. As our muscles move, it actually takes some of that blood sugar out of the blood. It needs that energy to move. And so it gives the pancreas, which secretes the insulin, a little bit of a break. The muscles say, I got this. I'll take care of this. Pancreas, you take a little rest right now. And so the more movement we're putting in, that can be helpful. And the more muscle you have, because then you need that muscle, those muscle cells, there's more of them to be able to pull that sugar out of the blood. the better case you're setting yourself up for supportive blood sugar management. Again, another lever, that movement lever you can pull on to support your body in managing blood sugar. So that's just a starting point on the activity. Jennifer, how do you help patients with the activity component, the movement component when it comes to managing blood sugar?
For sure. I mean, I think definitely it depends individually where the patient is at and where they're starting, right? But if we have a very large gap we have to fill, meaning that we are sedentary here and we want to get here, which is resistant training and cardio activity regularly, we have to fill that gap somehow, but it's very slow. We need to do it slow and calculated and intentional. So again, we're not causing undue stress on the body, number one, but feeling overwhelmed is a huge part of this as well. So I generally will start with very, very small intentional goals towards maintaining or building skeletal muscle mass, as you had mentioned. And so what that can look like is literally, if you feel like you can't get up and move or you have no energy to do it, you can start utilizing chair exercises with some small weights and work on your upper body for 15 to 20 minutes, 3 times a week, right? So just very small, achievable goals. And if that's too much, hey, let's back it down to 10 minutes. And maybe we don't use the weights the first time. Maybe we just move our upper body. So again, it's about that skeletal muscle mass and building it and maintaining what we have, but it's about getting there in a slow, calculated, intentional way so that we're not causing undue stress on the body itself, and then, of course, on mental health.
Thank you. Yeah, lots and lots of things we could talk about related to movement too. So I like where you mentioned just start where you can. One thing before we go into some questions to take here, I just do want to touch on continuous glucose monitors because they are out there and now you can get them. You can get them direct to consumer.
Sure.
If you have diagnoses of prediabetes or diabetes, often they are covered by insurance. Certainly, that's a question for your prescription providing or diagnosing provider and your insurance company, but it's easier access, and these can be tools. I want to mention though, it is a tool that if you aren't familiar with blood sugar function, you want to work with a clinician, be that a physician or a dietitian, that can help you understand the data. And then they could be great tools for looking at patterns or trends in your own blood sugar and how it responds to some of the strategies we talked about. But I would caution if you have never looked at blood sugar before and it's a new area for you, which most people it is, do get clinician support on understanding the data points so that you are using the data correctly. Jennifer, do you have anything to add to that? That's
I
kind of what I've
do,
seen in
yeah.
the
And I
notes.
think it's so important that you said work with a clinician that understands blood sugar balance and blood sugar levels, because there are certain instances where alarms can start going off when you're wearing continuous blood glucose monitors saying you have a very low blood sugar level or a very high blood sugar level. And although these are wonderful tools, and I definitely advocate for wearing them and using them as a tool in your toolbox, they are just that. They're a tool and they're technology, and sometimes we can have some issues with how they work, right? And sometimes specific alarms are not set to where they need to be for the high highs and the low lows. And so then we have patients that are nervous and scared if their blood sugar has just risen slightly, right? And not into that danger zone. There's also instances where if it's not placed correctly, we can have compression lows, right? So if it's not placed in the right place on your arm and you sleep on that arm, that can start to have an alarm go off in the middle of the night, which can be quite scary, right? So I think just working with someone that really understands the nuance that this is technology and a tool, but not necessarily the end all be all, because we also have to think about symptoms. We have to think about nutrition, right? Exercise, sleep, all of those wonderful pillars of health that go into management of blood sugar balance, diabetes, menopause, perimenopause, and anything hormonal related.
great considerations just to take into account. It's always the tool's only as good as what you need it for and who's using it, right? At that
Right.
point. All right. Well, we will pause there and use the rest of the time for some questions. So, Tyler, if you want to come back on and help us with those, I do see some in the chat that some you might be able to address, and I'm happy to take some that you aren't. And then if there's any additional questions, throw them in the chat and we'll get to answer them with the time we have left.
Yeah, absolutely. Yeah. Well, thank you both, first and foremost, for that really engaging conversation. I appreciate your insight and your wisdom, and I know a lot of really helpful insight was shared. You had actually, Stacy, you'd already kind of gone through the first question, talking just a few minutes ago around the measured test over time. But this second question, I feel like I might be able to provide a little bit of an answer, but Stacy and Jennifer might be helpful to provide your context. This individual had asked, if you need help with menopause and diabetes, do we suggest making an appointment with two different doctors? And I'm going to assume, based off of that, the two different doctors, I'm assuming maybe one of our OBGYNs and our RDN, maybe that is what was meant with the two different doctors. I think our suggestion would always be absolutely see one of our RDNs, set up an appointment with one of our RDNs, and also set up an appointment with an OBGYN. But I wanted to take it a step further as well, because sometimes for these specialty care, especially with diabetes, people will often ask, do I need to stop seeing my PCP and just see an OBGYN with Genev? And the recommendation, our chief medical officer, Dr. Rebecca Dunsmore-Sue, she always states, continue seeing your PCP, just see us as an additional level of support that you can get. And then consider our RDNs as that added layer of support, even beyond what our OBGYNs can provide. So hopefully that helps answer your question there. Stacy, do you have anything to add?
I think this is a good, Teresa, thank you so much for bringing this up. So there's a couple layers here. So if you have diagnosed diabetes, you would certainly still keep working with the physician that diagnosed and is helping you to manage that specifically. Our physicians are menopause specialists. They're not diabetes specialists. They're physicians. They know about diabetes, but they're not going to be in the position to help you manage that. Where they can be helpful, though, is supporting the menopause symptoms that may be also contributing to either an exacerbation of the diabetes or just that intersection of, where it's a holistic approach. And sometimes that can happen. And there is data to show that if you are able to, if you are a candidate for menopause hormonal therapy, that it can support blood sugar management and helping to mitigate type 2 diabetes. So there may be an area where our physicians can overlap with the care of your physician that's managing the diabetes, and then absolutely bonus, add in the dietitian, get the lifestyle support, and that's really where you're going to have that ultimate team that's supporting you in your overall metabolic health. So great question there, Teresa. And again, coming back to our physician teams are not in the position, or our dietitians, to diagnose diabetes and then manage the treatment, where ancillary to that other support that you should already be getting.
That's perfect. Thank you, Stacy. I knew you would say it way better and explain it way better than I knew I could. So thank you. I'm going to go ahead. We have just about 2 minutes left. And so what I wanted to do is go ahead and just ask our last poll question for the day. I've just inputted this into the chat, but the question is, or not necessarily the question, but the statement states, I feel more knowledgeable about menopause after attending today's session. And it starts with highly agree all the way down to highly disagree. We obviously are hoping that you took a lot away from today's session. We'd hope that you'd highly agree. That poll question should be there in the chat. I know for some reason our poll questions oftentimes disappear on people, so I do apologize. But feel free to leave any additional comments outside of one of these particular poll question answers if you'd like. With that said, I think that kind of concludes us. We're kind of at time, which is absolutely great. For those of you that have stayed for the entire presentation and webinar today, we record these sessions and I end up uploading them to our YouTube page. So just a very quick plug to Genev Genev's YouTube page as well as genev.com. What I do suggest is just keeping an eye out on your inbox. I send out a recording of this webinar as well as some helpful information around what was discussed today. What I am doing right now is just getting our YouTube page pulled up so that you might be able to go to there after the fact. I should have had that pulled up before, and I apologize, but I've got it now. Perfect. There we go. I've just added that into the chat. So that is our Genev's YouTube page. That's where you can actually go back and watch any of our content that we've done previously, including today's webinar, which will be uploaded shortly. But with that said, Stacy and Jennifer, thank you again. We thank you all for attending, and have a great rest of your Wednesday and a good rest of your week. Take care.
Thank you, everyone.
Thank you, everyone.